I'm Mary Jalonick, and I'm president of the Dallas Foundation. And first of all, I want to welcome you all here today on a Monday morning at 8:30 in the morning to have you all show up. Thank you so much. I really appreciate it, and we're definitely going to make it worth your while. The Dallas Foundation turns 85 years old this year, and we think our tagline says it all, here for good. And yet, even with 85 years of experience to draw from, we know that our work has just begun.
We all want to make a difference in our communities and in our world, but a blank page can be daunting. Where do you start? It all begins here, the Dallas Foundation, here for good. For over 80 years, the Dallas Foundation has been connecting donors with the causes they care about. We connect people to people who need help. We connect donors to rewarding experiences. We connect donors so their gifts can help make our community better. Texans care deeply about a variety of issues facing Dallas today: children, education, healthcare, the arts, animals. We're in the business of turning donor ideas and aspirations into results. The Dallas Foundation holds the charitable funds of hundreds of donors, large funds and small funds, living donors and deceased donors. As the oldest community foundation in Texas, we have a long history of assessing community needs and moving forward in innovative ways to address and fund them. With the Dallas Foundation's decades of experience, we are experts in helping donors tailor their giving to make their philanthropic dreams possible. For those donors seeking direction, the Foundation's knowledge of the community assists them in setting a course for a strategic, more engaging, and more satisfying donor experience for the greater good of our community. The Dallas Foundation touches nearly every aspect of life in the city, from the arts to social and human services. It is the place of choice for those who want to make a difference and give back to Dallas. Here for good. The Dallas Foundation is a community foundation, serving the community of donors, serving the community of Dallas. As experts in philanthropy, the Dallas Foundation is here for good, here for you. Please join us in making a difference.
Thanks. It's hard to explain a community foundation, so hopefully that's helpful. You always have little kinks that happen when you have a program, and we had Mayor Rawlings coming right now to do an opener for us, and he called Melinda, or his wife actually called Melinda this morning at like 6:30 in the morning and said he's got the flu. So he will not be here, but that's all right. We're just going to move on ahead, and it gives Francis and Libby more time. That's right. So to introduce Francis and Libby is the incoming chair of our board, Jay Puckett, who is a principal with Boston Consulting Group. Actually, at this exact moment, he's vice chairman of the board, but we have a board meeting this afternoon, and he will be chairman by 5 o'clock this afternoon. So, Jay.
Thank you, Mary. And thanks to all of you for coming today. We really appreciate you coming out today to hear from our distinguished speakers. We have two great speakers for you today, Dr. Francis Deviney and Dr. Libby Doggett. Let me give you a little bit of background on our two speakers who've traveled here to Dallas today. Dr. Francis Deviney is the Texas Kids Count Director at the Center for Public Policy Priorities in Austin. She tracks the status of children in the Texas Kids Count Project, which provides state and county level data on over 70 measures of child well-being. Before she joined the center, Dr. Deviney conducted research on transforming high-poverty, low-performing schools and districts at the Southwest Educational Development Laboratory. And prior to her work with the Educational Lab, she was a legislative director for a Texas state representative and worked for successful passage of legislation that strengthened child abduction laws and protected children's rights during lawsuits. She holds a doctorate in developmental psychology from the University of Utah. Dr. Deviney, we appreciate you being here today. I'm going to also introduce Dr. Doggett. and then they'll come up and speak one after the other. Libby Doggett is Deputy Assistant Secretary for Policy and Early Learning in the Office of Elementary and Secondary Education at the U.S. Department of Education. She brings to the department a lifetime of early learning experience from her work in schools, with Head Start, and in child care. Previously, Dr. Doggett was director of the Pew Home Visiting Campaign, where she oversaw research and worked with advocates in target states to build support for data-driven investments that align with federal guidance. And prior to that, she directed an organization called Pre-K Now, a 10-year campaign to advance quality pre-K for all 3- and 4-year-olds in states across the country. Earlier in her career, she worked for the U.S. Department of Education as Executive Director of the Federal Interagency Coordinating Council for Infants, Toddlers, and Preschoolers with Disabilities. Dr. Doggett began her career here in Texas as a bilingual first-grade teacher in Austin, and she holds a doctorate in early childhood education from the University of Texas. Please join me in welcoming our speakers today. Thank you.
Well, good morning. How's everybody doing? Good. All right. So today, has everybody had their coffee? Yeah? I will be showing you some bar charts, so I want to make sure everybody is good and caffeinated and ready to roll. Not that they're not exciting, not that they're not going to move you to tears, but just want to make sure you understand that we're about to get serious into the data. So, my name's Frances Deviney. I direct the Kids Count project at the Center for Public Policy Priorities. And today we're going to be talking about the early childhood data equation for Dallas and Texas. Now, I've been sharing with several of my friends and colleagues that I actually was a little bit nervous about this presentation this morning because at Kids Count, we collect information on over 70 different measures of child well-being, which include early childhood, but it also includes data on health and data on population growth and on child welfare. And so it covers a broad range. And I said, I'm going to be talking to this room of really deep expertise, right, on early childhood. And so what I'm going to tell you this morning is that I'm not going to come here and tell you about your kids, okay? I'm not going to come here and tell you about how you need to be running or changing or doing your pre-K programs. What I'm going to talk to you about this morning is about early childhood in Dallas and in Texas, and the broader, and setting the context for what kids 0 to 5 are experiencing in kind of their home lives and their communities, and how that affects early childhood education, because we can't ever think about education standing alone, right? We have to think about kids coming from a larger community and a larger context, and that's why we were so thrilled to be invited to do this with the Dallas Foundation, because of their focus on community, about bringing people together, about bringing together business and philanthropy and local leaders to really make great change. And that's what the Kids Count data is designed to do. So, Stuart, I'm going to wander. You ready? All right, I'm a wanderer. Is that okay, you guys? Yeah. All right. So, can you, I mean, it's a little more dark in here, but I like to kind of get closer to you. See if you're sleeping. Make sure you're not sleeping. Is this okay? Can everybody see and hear me okay? All right. So, a little bit about me, just to start off with. I am a woman with both feet firmly planted in the left side and the right side of my brain, okay? And I'll tell you what that means. So, growing up, I actually had a father who was an engineer, an aeronautical engineer, and, you know, God help when I would ask him to help me with math, because he would derive the Pythagorean theorem, and it was just like awful, and we were just trying to figure out something that's simple. So I grew up in a household very heavy into math, very heavy into science, and I actually ended up majoring in developmental psychology, but a very big focus on statistics, okay? Then on my right brain side, I actually also grew up with a mom who sang and sewed and did theater, and I did musical theater and met my husband that way. So I've got these kind of two competing sides of my brain, right? And so I always wondered, how can I actually make these two things meet? Well, what's exciting is that in the world of advocacy, it's really what we know is that story is really what compels people. We talk about these classic stories, right, of Romeo and Juliet, or even my more favorite story, The Princess Bride, right? And that's like, We got some Princess Bride fans in the room? All right. So those are the stories we come back to again and again, right? The ones, because we find some identification with them, right? They speak to our heart. But what do we learn about community and about what's happening with all people when we talk about story? Now, what I learned from Romeo and Juliet and the Princess Bride is like, don't mess with guys because they're going to get you in all kinds of trouble, right? No offense, guys, but you know. But when you have story by itself, it's a beautiful thing. You capture the heart. It's really important. But you don't know what it tells you about the community, right? And so we need data, right? Apparently you need really thick glasses to really read data, but we need data to be able to help tell us what's actually happening community-wide, what's happening with the majority of children, what happens when we change a policy, how is it impacting people. So together we need data and stories, and that's the 1-2 punch. And that's why I'm really excited to be here with you today, because I want to share with you the Kids Count resource, because you are the storytellers. You are the ones who have the great stories, right? If you're working directly in childcare community, if you're actually helping support with curriculum or whatever, like so with educational first steps, or you're actually out in the community and you're doing funding, you may have stories about families and children, but you may not have the data. Now, fortunately, you have organizations here like Commit who have really great data about early childhood in Texas and researchers heavy in the university areas that have really good data. But it's the marriage of the two that's going to be really important. So
With
here's a little story about
74
Kids
million
Count.
young people in the U.S., who's making sure all children have the resources they need to reach their full potential? There are those who work to improve the lives of children and their families, to make sure their voices are heard. A journalist investigating the lack of healthy food in her community. A policymaker trying to provide affordable childcare for working families. Or an advocate addressing the growing youth employment crisis. They are agents of change. But oftentimes, they don't have the tools they need, and the information that would make change possible is hard to access and comprehend. It's time to harness the power of data. The Annie E. Casey Foundation's Kids Count Data Center contains thousands of child well-being indicators related to education, health, poverty, employment and income, and youth risk factors. With data ranging from nationwide and state levels to city, county, and congressional districts. The Kids Count Data Center and network of state advocates support those looking to support children and their families. When we use data to inform decisions and to help others access the resources they need, we're giving children a better chance at life. Harness the power of data. Become an agent of change. You can make a difference.
So that actually kind of gives you a little insight into what Kids Count does. It helps you become an agent of change. Now, this is a brand new video from the Annie E. Casey Foundation, which funds the Kids Count project. How many of you have heard of Kids Count prior to today? Okay, great. So I will give you the backstory. Excellent. Okay. So what Kids Count does is helps you become an agent of change, right? It helps you be able to get that story, get the data to back up the stories when you actually go talk to your family, your friends, your neighbors, your legislators, your elected officials, your board members. Every year we put out a book called The State of Texas Children. It's our annual Kids Count data book, and we talk about those 70 different measures of child well-being and what the bigger story is around kids in Texas, and specifically how the policies we make up at the state capitol impact and create change for kids, whether that change is improvement or whether that change is maybe putting us in the wrong direction. So what we know is that we can actually make big change for kids. You're doing it in Dallas, you've been doing it for years, we've been doing it at the state level. And when we think about kids, what we know, in order to make change, there's some really important elements that have to be in place, right? Kids have to have the same opportunities regardless of what they look like, regardless of their family position, regardless of where they live, right? There has to be some equity there for kids to be able to succeed. We have to have things in place, all of the elements in place to secure them financially and to secure them through health and to secure their nutrition to be able to move forward in life. So we have to have security in place. And no matter where a child starts out, it shouldn't determine where they're going to end up, right? Even if a child starts out in kind of a situation that's not best for their development, that shouldn't be a defining predictor for where they end up as an adult. So there has to be opportunities for mobility. And that's going to require the community coming together to be able to provide those really important platforms for kids. In order to do that, we have to have investment, okay? We have to invest in kids. That investment means community investment, that means personal investment, people time, but it also means funds, finances, to be able to put the things in place that kids need. So we were curious about this. You know, there's the big debate about funding, pre-K programs funding, public education funding, and so we wanted to say, well, there's a lot of debate in Texas about where we put our money and what we do for our priorities. So let's actually look and see how we spent our money over the last 20 years. We did a study that looked at the state budget, and we looked at where we spent money in health, where we spent money in education, where we spent money on child welfare and nutrition over the last 20 years, and then compared it to outcomes for kids. Now, we were a little nervous about this because we thought, oh my gosh, what happens if we actually find that we invest money in kids and the kids aren't doing any better? But fortunately, that is not what we found. Thank God, right? So in Texas, when you invest money in education, education outcomes get better. We adjusted for inflation over time. We actually looked at population change. We looked at racial ethnic makeup and how that impacted. And even still, particularly when you invest more money kind of in the local areas, pre-K through 12th grade, when we invest more money in kids in education, kids' outcomes get better. Dropout rate goes down, graduation rate goes up. We have better test scores. We have better outcomes for kids overall. Now, we found the same kind of links between our health investments. When we invested more in health, parents reported that their kids were actually healthier. When we invested more in nutrition, we had lower rates of food insecurity. So in Texas, even though we actually don't rank very high in what we spend on our kids per child, we do know that what we do invest, we invest wisely. We're smart about it. We're targeted. We actually are very effective in the dollars that we do spend. But what was really exciting about the study was not just the links that you were hoping to find, education spending to education outcomes, but there were these cross-area links. And what we found was that when we invested more money in education, we actually found that kids also were related, it was related to their health outcomes. More money invested in education, kids had better health outcomes. More money in education, kids had better safety outcomes. And this is kind of safety around accidents and death and child death and teen death. And we also saw that with more money in education, we had better youth outcomes, fewer teen births, fewer arrest rates. All right? So this really powerful connection between community and statewide focus on our goals, on our priorities on kids, and when we invested more in those priorities, we actually saw things get better. The problem with these kind of correlational studies is that when we invest less, things get worse, okay? So as things go up in funding, things get better. When funding goes down, things get worse, right? One of the other things we found is that the reverse. When we invested more in health, kids did better in education. And when we invested more in nutrition, kids did better in education. So what's exciting about this is something you already knew in your heart and soul, right? When kids come to school healthy, and they come to school well-fed, they're ready to learn. Kids who come to school sick or kids who come to school hungry can't learn as well. So these are all those connections, and now we have Texas data to support it. Texas data on Texas schools, on Texas kids to say, when we invest wisely, but we've got to think about the whole child and all the contexts that they live in because it all works together. So, where does Texas and Dallas County stand? Now, in Kids Count, we talk about a lot of county-level data, but we do have access to some city data, too, which we can talk about a little more in a minute. But we're going to focus on 4 areas this morning. We're going to talk about family economic security. We're going to talk about kids' health. We'll talk about nutrition, and we'll talk about, finally, education. Given that our focus this morning is on early childhood, we'll be focusing on some early childhood indicators. And we're going to be building up to that education link. But I don't want you to think about education as the end point, even though this is kind of a linear presentation, right? Think about education as part of this larger context, that everything builds and feeds on each other. So, First, let's talk about who the kids are. So from 2000 to 2012, and actually let me back up before I give you this stat. From 2000 to 2010, so between the big decennial census, you might remember having to fill out that big old nasty form in the mail. Well, they actually look at that, and they put it back out. And in the United States, the United States added 2 million kids between 2000 and 2010. Texas accounted for half of that growth. Half of that growth. Isn't that amazing? And so now we're looking at so we've added a few years on the data we have. Between 2000 and 2012, Dallas County's child population grew by 45,000 kids, or it grew about 7%. But what's really interesting here is if you break it down by age group, kids 6 to 17, the number went down, actually. All of the child growth that's happened in the last 12 years, has actually happened in the 0 to 5 range for kids. All of the growth that's happened in the last 12 years has happened in the early childhood age range. Now, what's interesting is I went and looked at the birth data. It's not births. Births grew a little bit, but in fact, it's actually kids moving in from other cities and other states moving into Dallas. So young families coming into Dallas. So early childhood is really where it's at right now in terms of population growth and where we need to be focusing our time and attention because we've got a huge population boom there. So let's talk about economic well-being of children in Dallas County. Unfortunately, poverty is usually one of the things that is the best predictor of how kids are going to do throughout their life course. And what we see when we look at poverty data over time, this is for kids 0 to 17, we see that it's been actually increasing over the last 10 or so years. And what's really disappointing is that, in fact, Dallas was 3 percentage points better than the overall rate for Texas back in 2000, and now we're about 3 percentage points worse than the state overall. So we're nearly 1 of every 3 kids lives below the poverty line. What's really interesting about this is that during the recession, now Texas entered the recession later than most other states, and we left it earlier than most other states. We actually weathered the recession pretty well, comparatively. But what we found was that after we came out of the recession, poverty continued to climb for kids. And what was going on there is that nationally, what we know is that most of the jobs that were lost were middle-income jobs, and the jobs that we've gained back have been low-income jobs. So in fact, Texas has one of the lowest unemployment rates in the country. We actually do really good about getting people into jobs. The problem is we also have the 3rd highest rate of jobs that pay minimum wage or less in the country. So we have a lot of families working really hard but still can't make ends meet. And unfortunately, when a child grows up in poverty, that creates what we call toxic stress for the family, where the child's exposed to a lot of stressors because the family maybe has to move a lot because they don't have money to be able to pay their rent, or they don't have food to put on the table, or mom or dad are working 2 and 3 jobs to try to make ends meet, so they're not there to be able to provide the nurturance. There's all kinds of things that are going on for kids. And when we break it down by age again, what we see is that kids 0 to 5 are the most likely age group to live in poverty. Now, a lot of this has to do with kids 0 to 5 are with younger families who the parents are younger and so they make less money. There's a lot of that going on too. But also because we don't have universal pre-K or universal child education programs, many families have to have one of the parents come out of the workforce because they can't afford or cannot find good quality care for their kids. And so that's going to reduce the overall income of the families. So that's impacting it too. So what a lot of people don't know is when we talk about poverty, we kind of know what it looks like. We think about the child coming to school that maybe has the same clothes on every day and they're dirty or they don't have money for lunch or something like that. But they may not realize that poverty is actually a very explicit income cutoff defined by the federal government. And it's updated every year a little bit. But to give you an example of what we mean when we say children living below poverty, for a family of 3, you have to make less than $18,498 a year to be considered officially poor, okay? I live in a family of 3. I cannot fathom trying to make it on $18,498. If you make $18,499, you're no longer officially poor. Whoop, whoop. You made it, okay? So it's a very specific income cutoff, and that's really important because determining eligibility for a lot of our support programs that we have for families that are low income, determining eligibility for even pre-K is based on a percentage of that number. Now, pre-K is going to be higher because it's based on whether or not you get free or reduced price lunch at school, which is a higher cutoff. But even still, this number is critically important for determining what children have access to in our public programs. So what does this mean for kids' health? Well, we know from research that when children are living in poverty, they're much less likely to be insured, okay? And actually, before we go on to the insurance stuff, I didn't add a slide in on this, but I want to make sure everybody's familiar with, many of you have heard of James Heckman, the Nobel laureate who works a lot on early childhood work. He just released a study with many of his colleagues in the Journal of Science, and it showed the, I'm not going to say this right, I always say it incorrectly, the abscessarian, abscessarian. I've only practiced that about 40 times. Abscessarian program. It showed that very exciting new findings that not only did kids who attended the really high quality early childhood education program, when that was paired with early health screenings, kids were showing, when they became adults in their 40s, were actually showing better health outcomes. They were less likely to have heart disease and hypertension and all these other really exciting things. So again, it's this pairing of health and education together that really has the biggest impact. So in Texas, one of the biggest determinants of how kids are doing is this uninsured thing, right? For so long, we've had the highest uninsured rate for kids in the country. And the problem is that the way our health insurance market works today, you have to kind of have health insurance to get preventative care. Now, in cities like Dallas, there are clinics and things that are available for people who don't have health insurance and maybe can walk up, but they're overburdened, they're understaffed, they do a monumental job with the resources they have. But if you really want preventative care in a medical home, you got to have insurance, right? So what we know is that when kids live in poverty, their parents are more likely to report that they are not in very good health. And when kids are uninsured, they're not as in good a health as kids who have public insurance, and particularly compared to kids who have private insurance because of access. It's access to doctors, it's preventative care, and that's what's going to affect kids when they walk in the door of the schools. Are they healthy? Are they getting that preventative care? Are they getting their asthma taken care of? Are they getting their allergies taken care of? All that kind of stuff. So when we break that down by early childhood, we also see that even though young kids are more likely to be insured, in Dallas they're still they're less likely to have insurance than the state overall. So there's something about what's going on here in Dallas, and I can't, I would have to have a community conversation to figure out what's going on, but young kids are less likely to be insured here than in the state overall. Now, where this gets really interesting is that most of the time we talk about this as a welcome mat effect. When parents are insured, kids get insured, okay? And so what we know is that 1 of every 3 Texas adults is uninsured, and that number is about the same in the cities as well. In Texas, we don't really have any public insurance options, broad public insurance options for low-income families. And the reason this is important for kids, and young kids in particular, is that if we had an opportunity for parents to become involved, to become connected with public insurance, that would bring on a huge group of kids to our public insurance that's already available to them. And as we saw, when you get onto health insurance and when you get access to care and you get a medical home, you're more likely to be healthy. Now here's the thing. Now, okay, we're going to talk, breathe in and breathe out. We are going to talk about the Affordable Care Act. Are you ready? Are you steeled for this conversation? Okay, so there are lots of things to like about it. There's lots of things to dislike about it, whether you are liberal, whether you are conservative. Nobody's perfectly happy with it, all right? I'm not going to tell you today that this is like the greatest thing since sliced bread. I'm not going to tell you that we need to get rid of it. What I am going to tell you are the facts about where Texas stands today in terms of the decisions we've made around the Affordable Care Act and why this is important for kids. So, it's the law of the land, it's passed, this is the deal, we gotta work with it, right? But here's where it differs for kids in Texas. So let's take an example of the Castros. So this is a 4-person family. They've got an office clerk and a part-time home health aide. They make about $23,000 a year together, right? That puts them just below the poverty line. And their annual premiums are estimated to be about $8,700, okay? Now that's knowing that their kids could actually be on the Medicaid program. Their kids would be eligible for Medicaid. So that's just kind of for the parents, for the annual premium. But the parents don't have access to Medicaid because we did not have that option in Texas. We did not take that option. And so they don't have access there. But fortunately, we think, okay, we know about these subsidies, right? We've heard about the subsidies. So if you can go on the public insurance, or you can go on healthcare.gov, which was a mess, and it's gotten better, but if you can sign up for health insurance, there's these subsidy options to be able to help you pay for insurance, right? Not for the Castros. The reason is because they're below the poverty line. When the law was written, there was an assumption that Medicaid expansion would happen for all adults, and so that they would be covered under that option, and so we wouldn't have to worry about providing subsidies for low-income families because they have that other option over there. But when the Supreme Court decided that we couldn't mandate to do Medicaid for all adults, then that left this parent gap, okay? If you compare it to, so they make $23,000, let's look at the Compas. Maintenance worker, stay-at-home mom, they make about $24,000. That puts them at just barely above the poverty line, 102% of poverty, right? Just right over the top. Their annual premium is the same, about $8,700. They also don't have access to Medicaid. They make too much, even if we did expand it. They get $8,200 in subsidies because they are barely above the poverty line. The other family, the Compas, are above the poverty line. The Castros are below the poverty line. So, sorry, Castros, you don't get any assistance, okay? Now, however you feel about the Affordable Care Act, however you feel about that, the fact is that today in Texas, low-income parents don't have access to health insurance. And right now, we know we are not reaching about half of our low-income kids and getting them into the health insurance system. And that's even when factoring in children who are undocumented. We're still not getting to half of our kids who are eligible. This impacts their health. This impacts how they come to school. This impacts when they're going to be ready to receive education. Are they going to be ready for school? This is a big deal. And what's unfortunate is that if they just go over to New Mexico, those families actually have access to it because there's been many states who've decided to expand Medicaid for their families. So those kids, when they get signed into health insurance, they're going to actually have more access to health and have better outcomes. So this is just a fact of what's going on. You can have different opinions about it, but I wanted to make sure everybody was really clear on what kind of the Medicaid gap was. We also know that nutrition has been critically important for young kids. 1 of every 4 children in Texas is considered food insecure. That means they don't know where their next meal's coming from or how they're going to pay for it, okay? We know that we've actually made it a little more difficult for families to be able to access food, particularly for low-income families. Late last year, we actually made some pretty significant cuts to our Supplemental Nutrition Assistance Food Program, SNAP, what used to be called food stamps. Because we were in a budget crunch and we made some decisions to pull back on it, we cut what ended up being about $30-some-odd a month from families' food budgets. Now, $30 doesn't seem like that much, right? But when you actually break it out into what it buys 9 gallons of milk a month, or buys 23 loaves of bread for a family. That's a lot of food, and that's a significant impact for low-income families. It increases the likelihood of food insecurity. We also know from research that actually was done here in Texas that 3 out of every 5 teachers report that their kids come to school hungry. Again, significant impact on whether kids are going to be ready to learn in school. Now, the exciting thing is that we've made some really great decisions on this in Texas. We've actually tried to close some of that hunger gap for kids. Last session, we passed a bill that expanded school breakfast. In previous sessions, we had expanded school lunch options and summer food, and now we expanded school breakfast. And so now, moving forward in the 2014-15 school year, schools have the option, if they have 80% or more of their children who are considered economically disadvantaged, they can actually get additional funds to be able to provide school breakfast. So for the whole school. So there's no stigma associated with it. Many schools are trying out breakfast in the classroom, which actually gets even more kids involved. So the kid doesn't have a hungry tummy that's going to interfere with their learning process. So this is a really positive move that we've made in Texas, and I think that's incredibly exciting. And those kids are super excited about it too. So how does this all tie back into education, right? Well, we talked about how the funding links. We've talked about some of that exciting early childhood education, long-term outcome research. What we know in Texas is that many kids start out behind, and this is where pre-K is so critically important. From national research, it shows that Texas has the worst rate of parents who read to their young children on a regular basis. Nearly 1 of every 4 kids is not read to between 2 and 3 times a week by their parent. This is critically important. I know you've all heard these statistics where we say kids who come from higher income families hear over 1 million more words than kids who come from low income families, right? And that quantity makes a huge difference, but it's not even just quantity, it's the quality of the conversation too. And when you read to your children and you engage them in that way, you're getting richer dialogue, you're getting richer verbal exchange, and that's going to help children develop their own language and get them to be more ready for school. So we're starting out on a deficit there. On the bright side, we've actually seen that over the last 10 years or so, we've significantly increased the number of children participating in pre-K. Now, in the Kids Count project, we actually look at 3- and 4-year-olds together, and then we look at how many 3-year-olds are participating and how many 4-year-olds are participating out of the whole 3- and 4-year-old group. What we know is that we actually have about 51% of Dallas 4-year-olds are participating in pre-K. Only about 3% of Dallas 3-year-olds are participating in pre-K. Now, that's kids overall. It's not just eligible kids, that's all kids, right? When we look at eligible kids, I know the Commit research recently found that, I believe it was when you look at 3- and 4-year-olds together, it's about 66% of eligible kids are not participating. I would definitely check out their report. It's got some really good local statistics that you should look at. So we've made some huge strides. We actually only had about 40% of kids participating in, 4-year-olds participating in pre-K about 10 years ago, and now we're up to 50%. That's really great. Part of that has been the choices that we have made as a state to prioritize pre-K and early childhood education. We had what was called pre-K expansion grants, which helped schools when they wanted to start new pre-K programs or build on their pre-K programs. They could get funding from the state to help do that enhancement, and that helped to grow our pre-K program. You notice I said had. We'll come back to that in just a minute. So, we also know here in Texas that, and this is a very simple study, it was actually done by Representative Villarreal, because he's a nerd like me, love the nerds, and he looked at kids who were in pre-K and their later tax scores. Now, we don't have this new data for STAR yet, because we haven't had the kids around long enough to be able to have STAR around long enough to be able to look at that yet. But what we know is that when you look at kids who are from lower income families, when they participated in pre-K, 3 years later, 4 years later, when they were in 3rd grade and they took their math tests and their reading tests, they did better than their peers who didn't go to pre-K. And he took out all like different data about looking at race, ethnicity, and looking at all these other factors. And it still was there was still a relationship. So we know, even in Texas, that when you participate in pre-K for those low-income kids who start out at a deficit, it does make a huge difference in terms of their later test scores. We also know that we've been doing a really good job reducing the attrition rate, because ultimately what we're talking about is building really good citizens and building strong Texans and building a great economy and building good people, right? That's what we're talking about when we're talking about the importance of pre-K. It's not just that we want them to have a really happy 3- and 4-year-old experience, right? We want this to actually build on itself and create a solid foundation. Part of that pathway, and this is something that the Dallas Foundation talks about a lot of times is talking about, and the commit report talks about, is like this pathway from early childhood to college is getting out of high school, right? We've actually seen a significant reduction in our kids who are leaving before graduation. Now, no matter how you measure it, we can talk about attrition, we can talk about dropout, we can talk about, there's lots of ways to measure it, and there's lots of arguments to be had. But whatever measure you use, it's getting better. It's going down, it's good, all right? We're still losing about 1 of every 3 of our kids in inner cities, but it's getting better. It's going on the trajectory that we want. And we're also seeing graduation rates increase. This is also because of a joint public-private effort partially funded by the state to get kids to stay in school through graduation. We had high school completion grants that we were providing to schools to really use local knowledge and local expertise with state funding to support it to keep kids in schools, and it was working. It was doing great. We were actually making strides. And this is critically important because it creates that cycle of poverty and that cycle of economic disparity. Because if you don't get out of high school, you have over a 1 in 4 chance, almost a 1 in 3 chance of living in poverty. If you get out of high school, that's just about cut by 40%. Okay, you're reducing it significantly, the chance that you'll live in poverty. If you get an associate's degree, you have a 1 in 9 chance of living in poverty. And a bachelor's degree, it's almost gone. So the fact of education being a powerhouse for economic stability is huge, and it starts in pre-K. Now, back when this study was done, and it hasn't been redone recently, but we were 43rd in per student education spending compared to other states. Now, the upside is compared to we have our national education outcome measures. Texas does actually pretty well on our state testing compared to other states, particularly for kids of color. Not great, but compared to other people, we're doing better. So we actually have a decently strong education system, even being 43rd. But in 2011 legislative session, we cut public education, which included pre-K funding, by $5.3 billion. It's a billion with a B, okay? $5.3 billion, and that came up to about $500 per student on average. Well, those cuts included the elimination of pre-K expansion grants and high school completion grants. The things that were actually successful. It included a whole lot of other really important cuts too, but in terms of our conversation today, I want you to know that it included pre-K expansion and high school completion grants, things that were having success. So, what's our investment in kids going forward? Well, in the 2013 session, we actually put some money back into public education, which was great, definitely in the right direction. We put about $3.2 billion back, but that comes up to about $108 per student. The reason is because our student population grows every year, and it gets more expensive every year, right? So even if we put back in exactly the amount that we took out, it still wouldn't cover it because of inflation. And, I know I'm a data geek, and I know I'm kind of, I'm really excited about math, but I think everybody can really understand that 108 doesn't equal 500, right? We were moving in the right direction. It's definitely putting money back into education is great. We want to do that, but it didn't even come close to filling the public education hole. So we're kind of left holding the bag, and communities and local school districts are the ones who are having to fill the gaps. Now, what's our current investment in kids? Well, for education, back in 2011, prior to the cuts, we were spending about $3,500 per kid, and today we're spending about $3,000 per kid. In child health, we're spending about close to $1,500 a kid, and now we're only spending about $1,300. When you combine everything else together, nutrition, child welfare, all these other things, we're spending about $600 per kid, and in 2011, now we're spending about $550 a kid. So, why is that important? It's not just about the amount of the dollars, but based on our research and based on other research we've seen, we know that when we invest more in kids, when we provide them the resources, we provide them the richness, we provide them the opportunities, they eat it up with a spoon and they do better. When we cut those funds and we take away those resources and we don't invest in kids, they start to do worse. And that's critically important for the outcomes of our kids. So, where do we go forward from here? What's the equation? Well, it's not just about pre-K by itself. It's about the whole child, right? And pre-K is a critically important foundation for the child. But we also have to make sure that we have those kind of security and equity and the opportunities for mobility for kids in their economic security, in their health, and in their nutrition to be able to create that whole system for kids. So what can you do? So I've thoroughly depressed you. You're like, what am I going to do now? So one of my favorite quotes is from our former executive director, and she says, people who choose to do nothing still affect public policy, but their indifference supports, or their silence supports the way things are rather than helping things be better. So I want you to be like that little cartoon video in the beginning. I want you to be an advocate for change. And the fact that you're here today, the fact that you're wanting to come and listen about data about kids, you're wanting to come and learn from Dr. Doggett, means that you're already there. If you might need some extra tools, you might need some extra information, but you can do it. If there's anyone in here who got drug along because you're like visiting a friend and you got pulled along, there's easy things that you can do too. So first you can learn, just learn more. And we encourage you to go to our website, forabettertexas.org/data, and we have these wonderful data tools. Jennifer, raise your hand real quick. So my colleague, Jennifer Lee, is our data wonk extraordinaire, and she manages several different databases, including Kids Count. So we have a wealth of information for you to look at your community and find out how kids are doing and what's going on locally and how you can help. So learn more. You can go to the data center and get all kinds of really rich information. Then we want you to share what you know. Tell your story. It can be on Twitter, it can be on Facebook, it can be at your family dinner. Now, okay, you know what? You're gonna have a family, Sunday lunch coming up. It's gonna be awkward anyway. You might as well throw out some early childhood data and numbers with your family and talk to them about that. Make a little placemat that's got some bar charts on it, it'll be great. But those are the conversations that have to happen. I'm joking, but I'm not. Until we change the attitudes of our community about the importance of early childhood, about building around the whole child, about investing our resources for those kids, it's not going to change. Because our elected officials are doing what they think we want, right? They're all good people. They're all good people. I'm just kidding. They're all good people, and they're trying to do the best for their community. But until they hear from you that the decisions we made are not what I want and I vote, they're not going to make that change. And that's where you need to tell the stories that you have and back it up with data and say, this is not just happening to this one child, it's happening for our whole community. And then we want you to act. Now, I know this is really hard for people sometimes to think about contacting their elected officials, but I promise you, I worked in the legislature and they are like people too. Their cat runs away, their kid back talks to them, their kid wrecks the car, they're like, they have to take out the trash. They are regular people too, okay? They're not that intimidating. And on the top of that, when you call their offices, you're gonna get the 23-year-old like up answering the phone anyway. There's nothing wrong with being 23. God, I wish I was 23. But they're not as intimidating. But they are good and they are smart and they will take your message forward to the elected official. That is their job. So calling and saying, this is what I think is important, is critically important to moving things in Texas. When I worked in a legislative office, we worked under the assumption that one call equaled 100 people back in the district. So one call has the power of 100 voices, and they really do make a huge difference. If you can get 10 people to call, they'll be like, oh my gosh, this is a giant movement, okay? Isn't that true, Madeline? It is true. So we do encourage you to act now with your stories and with the data. So I will close today by just sharing with you the voices of Texas kids. If you haven't been convinced by bar charts, maybe these kids can convince you too about the importance of investing in Texas kids going forward.
I am the future of Texas.
I'm the future of Texas.
I am the future of Texas.
When I grow up, I want to be an artist. I want to be a teacher.
I want to be a race car driver.
A soccer player. A doctor. A volcanologist. I want to be a rock star. I want to help animals that are sick. It's important to go to school because you can get a job. So you can be smart. Because people need to know what 1 + 1 is. You need to learn. You learn things that you need to know for the life ahead of you. I like to learn about how the earth travels. I think math is really important. The water cycle. I like to learn about other people's jobs so I know what job is right for me.
When I'm sick, I get tired.
I feel like I really can't move.
Kids go to the doctor to figure out what's wrong with them, so then you don't feel bad anymore.
If you're not healthy, it's hard for you to learn in school. It's bad to be hungry because it distracts me and I really want to eat. And you can't think about learning. It's important to eat the right food to be healthy. It's hard to do your work when you're hungry. See, it's all connected. That is definitely true.
They even made studies about it. Educated kids make a better Texas.
Healthy kids
Make a better Texas.
Kids who eat right make a better Texas. Invest in us now for a better Texas tomorrow.
So I hope you all will take the data you've learned about today, what you're going to learn from Dr. Doggett, and really go out there and become advocates for change. Thank you very much.
Thank you, Francis. And I told you earlier on that we're sort of a little flexible in our schedule today. And when Francis was talking about public officials who really care about kids, we have one right here, our County Judge Clay Jenkins. And I wanted, before Dr. Doggett speaks, he's just going to, for a couple of minutes, say something to you all. And really, our legislators, our judge, our county commissioners, our city, we all need to let everybody know that we care about kids. And Judge Jenkins, if you want to say a word.
I'm glad to be here because this is a super important issue, and I'm glad to be at Scottish Rite Hospital for this issue. I first came here as a dyslexic child in the first grade to the Dean Learning Center, and it's because of extra help like the Dean Learning Center gave me that I was able to be the first person in my family to have the opportunity to graduate from college. Fast forward about 16, 17 years later, I met my friend Libby Doggett while working for her husband and other judges on the Supreme Court. And that is just kind of a personal story of the power of education, because as a dyslexic kid who had a hard time reading, my dad died when I was 7 years old, my mom worked 2 jobs, and it was a childhood where didn't have a lot of extra time to read in the home. My mom did read to us. But for me, it really brings home. When I hear this, I think back, I'm 50 years old, guys, but I think back to when I was a kid and the importance of what they're talking about. I want to give you just some, real quick, some Dallas County numbers to illustrate this for you and to tell you what we're going to start working on tomorrow. Because for those of you who have been living like in a bunker and you just came out today, today is the last day to sign up for the Affordable Care Act health insurance, okay? Tomorrow is the first day of an invigorated effort along with the Dallas Regional Chamber, the Texas Association of Business, the Citizens Council, Mayor Rawlings and myself, and many others to push for Medicaid expansion so that 133,000 of your neighbors here in Dallas County can get the health insurance that they need. You look at the things that we've worked on over the last 3 years, and there's some good news and some bad news. Here's the good news. The good news is we said we'd build the tax base and get some good jobs south of 30, it's gone from $26.9 billion to $42.8 billion, the tax base south of 30. The unemployment has gone from 8.9 in Dallas County down to 5.9. So you'd think that the amount of uncompensated care that you're paying for at Parkland must have gone down too because of all those good jobs. It's gone up about $250 million over that time. Most of those jobs are not jobs that create, compost families? It's jobs that are leaving people in Castro families. And so that's why pre-K is going to be one of my real focuses over the next 4 years. We're working on a pay-for-performance pre-K plan similar to one that's been done in Salt Lake County, Utah. And if anyone is interested in hearing more about that or working with us on it, Shay Cathy, my policy advisor's right there. That sort of a plan would be where we seed money, you bring money in, Goldman Sachs and foundations and things put money in, and we provide more pre-K slots, not just in the city of Dallas, but for several of our districts that are in need. You know, there may be differences of opinion out here about education and about support our public schools and a host of other things. But I hope that we can all agree that whatever your vantage point, whatever your viewpoint, pre-K makes sense, and we need more pre-K. We've got a brilliant next speaker, and I don't use that term loosely, but I've known her for nearly 30 years, and I know she is, in fact, brilliant. And so it's my honor to introduce my friend, Libby Doggett.
So I'm going to try to follow up on Frances, who was an amazing speaker. What a great presentation you gave. And it was a beautiful presentation, but her knowledge and her advocacy are much appreciated. And thank you, Mary, for what you have done with the Dallas Foundation. The video really told it all, right? Because they've just built the city recently into what it is, I know with lots of other help. And thank you, Clay. I'm glad you're here, and I'm so glad you're in your position. There are 3 other people I want to thank before I get on, and one of them is Madeline McClure, who is my friend, who has done more for home visiting and children who are abused and neglected in this state than anybody. And then Jason Sabo and Jennifer Esterline are over there, and they've done more for pre-K in this state than anybody, because they are the people that when I was at the Pew Charitable Trust, we worked with. They were the on-the-ground feet that actually made the difference and brought more money into the services here. So I'm going to try to I'm going to condense what I have into about 15 minutes so we have time for your questions and we can actually have a conversation, because that's what I know you came for. So if I'm going pretty fast and you want me to stop, just raise my hand. It all started with the president, who really made a commitment. And I'm like Frances, no matter how you feel about the president, I know he's not the most popular person in Texas. I can remember sitting around a table in Austin, Texas, this is 30 years ago, and thinking, who could we get to stand up for kids? And we were thinking, is there an elected official? No. Is there a mayor? Is there someone in the state house? Is there a member of Congress? We couldn't think of anybody. We finally thought of Ronya Kosmetsky, who I hope some of you know, who actually then started a foundation and did a lot for children in Texas. Her husband came back from Teledyne and was at the UT Business School for years and years. So Ronya was our face years ago in Austin because we couldn't find a president. So now we have the top level of our country saying we got to do more for our young children. It's significant. I'm going to talk just briefly about the research, because that's why we're here. We wouldn't be here if there weren't good research. I think Frances showed some of it in a very compelling way. I want you to know there's 3 kinds of research. There's longitudinal studies, and there are 3 of them, the Abecedarian, the Perry Preschool Project, and one out of Chicago. They have been following children who are now adults for years and have really found compelling evidence that pre-K, and Abecedarian actually was before pre-K, it was home visiting and it was much more than just a pre-K program, but they found great results. long-term results. I think Francis has shown those. I'll go through them. Then there are another set of studies. So there's longitudinal studies. Now we have more recent studies that show that pre-K works in a full system. Some people say, oh, those were hothouse studies. There were small numbers of kids. We now have states that are doing pre-K, in either the whole state or across the state, and they can show that it works. New Jersey, they started from nothing with court order to do pre-K in 30 districts for low-income kids. They've done it. You have studies all over this country that have shown that if children get in early, you have to offer a high-quality program, and that is something that is critical. If the program's not a high-quality program, it's not going to make a difference. And then the third kind of studies you have, and I don't have a slide on this, are the brain research studies, where they put those little nodules on the kids and they look at the brain and they offer different kinds of stimulation. And I think that's really made the difference with the business community, because all of a sudden you can see it. You can actually see the difference in the child's brain when they get that stimulation. We have a couple of charts on international comparisons. Basically, what I want you to know is internationally, we are not where we need to be in terms of the number of children that are in quality settings or the amount of money that the United States is putting in. What is exciting is at the federal level, we now have a continuum of services. I think Francis made the point, it's not just one thing. It's not just pre-K. That's what I'm going to talk mostly about. But it is a continuum of services that families need. It's not for every family. I was up visiting my two nieces. We have 3 of those children that Francis was talking about, of the growth in early childhood here in Dallas. These kids are going to do great, but there's so many other children who need more. And so you start off with home visiting, Madeline's big push, which gives a mentor or a coach to a family that wants it. It's all voluntary, but you all know that there are mothers and dads out there who say, give me an extra hand, help me. I want to do better by my kids. We have programs for infants and toddlers with disabilities funded at the federal level, because we know that if you have a child with a disability, you need a little bit of extra help. We have child care funds. The child care funding, we'll talk about it in a minute, is going through reauthorization. But this slide really shows that you have a number of systems, and they all feed into K-12 system. And what we really consider the early childhood years are birth through 3rd grade. So it's really those first 8 years, and it's really important at every step along that way to have a variety of programs that offer different kinds of services for families that need it, and that you then follow up in the schools, because you can't just add pre-K. Because then if you add pre-K, you got to change your kindergarten and 1st and 2nd grades, because they've got to be better. You can't just do the same old thing, because these kids come in a lot smarter. So I'm going to go over kind of a series of programs that we offer at the federal level, and there are 2 in particular I want to talk about, because there are 2 funding opportunities, and I know there are people from foundations here and from the who are running programs. There's some opportunities here I want you to know about, because I'm hoping you'll pull some of this money down. So we have the McVie program, which is the home visiting program, and we just had a huge success. We got the funding for that reauthorized. We still need more. The president has made a pledge to try to get more. We need more for this program. We have child care. It's now being reauthorized. And the problem with child care is there's no accountability. It has basic standards. Right now, the child care bill is just trying to get some basic health and safety standards, and it's not a high quality program. So many states like Rhode Island have standards that are the same as pre-K for their child care. But in Texas, we still have a very basic floor. So unless a program is adding a lot, the children aren't getting the early childhood education that we want them to get. We have Title I. There's a lot of Title I money that's done, comes down federally to schools. It can be used for early childhood, even for home visiting. But unfortunately, in many schools, and I don't know what the case is in Texas or in Dallas, it's been used in the same old way instead of looking, hey, we have some new research. We know we know we can do things differently, and using that money in a different way. We have services, a whole slew of national services for kids with disabilities, which actually helps fund a foundation of professional development and technical assistance for all kids. Because if you can teach a kid like Clay to read and be so smart, you can teach any child. So really, anyone, kids with disabilities, they need a lot. And you have to really be able to teach well. And so we need to build on those services. So birth to age 3, we have Part C, which is the program for kids with disabilities. I actually ran a program out in the Texas Hill Country for these kids. You have Early Head Start Child Care Partnerships, and you see that new up there. This is a new funding source. It's $500 million. There's a ton of information on, and it's run by HHS. You can see we do it. We're in partnership with the Health and Human Services and the Department of Education. This is $500 million. They want to get some funding out to every single state, but there's more big states like Texas should be able to get in there and get a number of programs. It is funding that will go to a partnership. Anybody can apply for it. A city, a county, a school district, a nonprofit, a for-profit can apply for this funding. You get in, you make a partnership with a child care center. It can be home-based, it can be center-based. And you agree that with this money, that child care center will meet the Early Head Start standards for infants and toddlers. So it's a really creative way to increase the quality for our infants and toddlers. And I know the last time Early Head Start had some funding out, California foundations, Mary, got together and they helped give a lot of helped to get tutors for programs, helped get writers to write some of these grants. And I don't get to read those grants and make those decisions, but I read them afterwards. And I can tell when a foundation has come in and found a really good writer for a state. I read Michigan's Race to the Top application. It was incredible. So I hope you all will apply for some of this funding. It will be available in about another month, and that we can pull some of this funding down to increase the quality here in Texas. There's a particular interest in making this fit with home visiting and with pre-K and thinking about the whole continuum, even though this is just one piece of it. So then for kids ages 3 to 5, we have IDEA Part B, which is Section 619 funding. Every state provides pre-K for kids with disabilities. And that's a great program that you should make sure it's a part of your system. You need to grow it. You need to include those kids in regular settings. You have really great teachers there. You have speech pathologists. You have occupational therapists. It is a great program, and I know it's good here in Dallas. And then you have Head Start. Head Start's got to be a part of the system. It's a lot of money. And it comes down federally to the local programs. But you, as a city and a county, you need to look at where are your Head Start centers? Are they a part of our system? Can they take more kids? Could we put some more money in, some ISD money in, child care money in, private money in, to add more kids? Could we make those programs full day? Could we make them last in the summer? There are lots of ways to use Head Start money. I think we had a tendency sometimes to do it the way we've always done it. But there's more flexibility in Head Start, and it's a major part of the system. We need to make sure it's good. Some of the best programs in the country are in Head Start, and some of the ones that are not that great are in Head Start. Luckily, the Obama administration has been working hard to improve Head Start, and some of the ones that haven't been as high quality are having to recompete. It's been stressful for Head Start, but they've really been up to the task, and I'm excited to see Head Start stepping up. And then the other new funding source, and I'm here as an advocate for this certainly, is the preschool development grants. We at the Department of Education got $250 million. This funding will go to the governor. But there's not enough for the governor to do a whole lot throughout the state. So the governor's going to have to choose 2 locations in his or her state that were willing to take pre-K to scale. So it's a perfect opportunity for a community like Dallas or some rural areas outside of Dallas or Austin or San Antonio, I hope there'll be lots of competition here in Texas, to compete for this money. This is funding that is really a first step on the president's promise. But the president is attempting to get $75 billion for pre-K that would really take it to scale across the country. This is a first step. This is a down payment, the preschool development grants. This funding opportunity will become available this summer. There'll be 2 months approximately for the state and the local communities to figure out how they want to apply. When we've had an opportunity that was similar to this in the past, Texas didn't apply. Texas could have gotten some funding and we didn't even apply. So we're hoping very much that the governor starts hearing, and governors all over the country start hearing from local communities that want to do this. The Preschool for All, as I mentioned, is our North Star. It's our idea. It's in the president's budget. It was in the budget last year. There's a bill that's been introduced that would bring this funding down, and this would be significant. This would ensure that every single one of those children that Francis talked about had a full-day, high-quality program taught by a certified teacher in early childhood. And it really is going to happen. My boss, Secretary Duncan, gave a speech at the National Governors Association the other day, and he said, pre-K is inevitable, and here's 10 reasons why. And that's really true. It will happen. And it will happen because it's the foundation community, the business community, the military, the law enforcement community have all realized this is our future workforce, and if we can put some funding in early, we will have the workforce that we need in the future. So those are some of the state requirements. This is a high-quality program, and then there are some of the preschool individual programs. I know there are a number of people here that are probably from child care, and I want to assure you that, and everybody else, when we talk about preschool, you think about school. You think about, oh, we're going to add another grade to school. But truthfully, many children are already in a high-quality program out there. They're in, well, I think my niece is going to like the Dallas Day School. It's a great program. I got to go over and visit it. There are a number of really great child care programs out there. There's also Head Start programs out there. They need to be considered a part of the system. And other states, much more than Texas, are actually including them. So the school district will get the money, but then they'll say, hey, I want to work with these centers that are out there, and they work together and figure out what does that center need to reach the standards that have been set. And so in West Virginia, for example, over 50% of their pre-K, and they have pre-K for every 4-year-old in West Virginia, mind you, is in every 4-year-old's in pre-K, but 50% of them are in community-based settings. That would be allowed and would be promoted very much through this. So kindergarten through 3rd grade, we put $1 billion out in 20 states. This is the money that unfortunately you see Texas is white. We didn't even apply, unfortunately, because I think we could have had a good chance at it. But these states are working on building the system. You've seen how health is important, nutrition is important. You've seen all the variety of programs I've talked about. It's a virtual mess. And you've got to really figure out as a state, how do you build this? How do you put this together? And this $1 billion has been put out to 20 states that are working on it. Fortunately, we decided to have a 50-state strategy, so the technical assistance that we're offering to these 20 states is available for every state. So there's a website I'll show you in a minute. Just want to touch on all the things that are happening at the state level. My contention is that the county's got to do more, the city's got to do more, the school district's got to do more, the state's got to do more, and the federal government's got to do more, because this is a heavy lift. And fortunately, states are stepping up. Last year, 30 states, that's 17 Republican governors, 13 Democratic governors, put more money in for pre-K. This year, we have increased funding in Indiana, $3 million. Hawaii has a big bill on the table. My boss has just been out there. Mississippi, first time ever, put $3 million into pre-K. California has a major bill to provide pre-K, to expand pre-K for every 4-year-old in the state. It will pass. It's a matter of whether the governor will support it. New York yesterday, they reached agreement, or I think on Saturday, they reached agreement for $300 million. The mayor, as you probably saw in the paper, Mayor de Blasio wanted $350 million. Cuomo couldn't give that quite that much, so they settled on $300 million. It's pretty incredible. And then briefly, cities have stepped up. I have a slew of people coming through my office every week from a different city wanting to know how can we do more in early childhood education, and those are just a few of them that are working. So thank you very much. That's where the resources are. So there's ed.gov/early learning, and then resources from our program, the Race to the Top Early Learning Challenge Fund. You know, I think that Dallas is primed. I mean, just looking at the audience here with the leadership at the foundation level, now at the county level, I know your mayor is interested in this. I know you have legislators are interested. I think that Dallas could be one of those cities that I'm talking about in 6 months or 12 months. Thank you. Yep.
We have a few minutes for questions for Libby and Francis. Does anyone have any questions?
The chairs kind of looks
Oh, look,
formal.
chairs appear.
When you start a program, what's the horizon for being able to evaluate its success? Well, I mean, I think you can evaluate success in a year. You know, I think any program you want to give it a year. The first year is always difficult because you're just getting started, and are you talking about an individual program in an individual center?
I think that's what you're asking is a really sophisticated, complex question, and that's not a cop-out. I think there are multiple levels to answer that question, honestly. I think what your question brings up is really the fact that you have to know what it is you want to measure before you start. So many times we start, many of particularly when you're talking about a small program that doesn't have a lot of resources and doesn't have a lot of funding, and to think about putting a research plan in place prior to even serving one child seems a little silly on the front end a lot of times, but it doesn't have to be a research plan, you know, that you have somebody from UT come in and help you run it. What you can do is actually look at how many kids are you actually serving? How many meals are you serving from start to end? How many families are you reaching? Take what we call qualitative information from your families. That you can do on the short run. That you can do starting from, you know, comparing day 1 to 6 months. And that gives you the resources and the information to start understanding how to modify, how to adjust for the community, how to talk to your funders, how to get additional support. But in order to have that real longer term kind of like we've made a difference, you have to have a plan in place before you start about what it is you're actually trying to change, what result are you actually trying to achieve, right? And how are we actually going to measure it? And to do that, you have to really be very, very clear on what those individual kind of indicators are. And I would say, you know, like Libby was saying, I would say a year at minimum if you've got control over the data. You may have noticed that with the kids count information, a lot of it was like 2012, 2011, because there's a time lag on getting that data. So if you've got control over the data, you could do it in a year. If you're waiting for Dallas County statistics, you know, you might be waiting a couple of years or 3 years down the road. So it's defining your questions, defining who it is you're trying to influence, and defining the result. I think that's really important.
Over here.
We have a microphone over to the side, or it's over here, or just yell.
We'll repeat it.
One thing
It's a very generalist certification. I couldn't agree more. Actually, what you're saying is school districts have then got to go in and spend a lot of their money retraining the teachers. Because the teacher who's trained to teach 4th and 5th and 6th grade, where kids, you know, they're used to coming in, they sit at a desk, they open their book and they read, for the most part. Pre-K is very different. You really want children to learn through playing. In fact, if you go in and you see worksheets and kids sitting at desks, you're in a program where the teacher doesn't know what he or she is doing. So we need to rectify that. And school districts are now having to do that, education service centers as well.
Byron?
Byron Sanders. Our question, for one, and both of them have to do with, the first question is, larger investment in early childhood, particularly in those that had conservative leadership. Strategies at the state higher target. How to do is to drive demand. How to drive demand. Across the country. Well, in the public, particularly from...
I'll let you go first.
Well, there are lots of states that have actually done a really good job in a pretty conservative environment. Oklahoma is one of the best. Not a blue state, it's a very red state. And it did it because it had good leadership inside the government. So there was someone at the Department of Education, Ramona Paul, who really understood early childhood. She talked to a state senator. They had declining enrollment, so the schools were very eager to fill those classrooms, and they put pre-K in place for every 4-year-old. You could not drag that out of Oklahoma because that is for every child. It's not saying, oh, your income is here, you can go, or you were in foster care, you can go. No, you can't go because your parents' income is too high. So when you can reach every child, and many states have moved in that direction, it helps. I think in most cases, though, it has to be the governor leading this. I think you can see what's happened in Alabama, a very conservative state, but they've had now a series of 2 governors. They have a very high quality program, much higher quality than the Texas program, and every year they're increasing it. So, you know, having a governor helps. Having a good plan helps. I'll tell you one more and then I'll let Francis comment. West Virginia, it's an untold story. The legislature said in 10 years we will have pre-K for every 4-year-old. They put the money in and school districts could pull it down. They also had a provision that 50% of those seats had to be in community-based settings. So the communities had to work together to figure out how are we going to do this with Head Start and child care and make this a collaborative project. They had 10 years to do it. So that was a nice long plan. And now you can look at West Virginia and you can just see amazing things going on.
So I guess your question is really incredibly important because I will build on what Libby was talking about with having kind of the leadership be the forefront and kind of getting people to know and getting the programs in place and creating the will and the support on a broad scale. But I think we have to sandwich that too. And this is going to sound like a cop-out to your answer, but it's really, to your question, but it's really not. It's critically important for every single one of you in this room to go and talk to your family and friends and neighbors, not just about the importance of pre-K, but about how this is a community commitment to building the quality of lives in our area and to building the quality of our workforce and to building the quality of our human experience, right? Oh, sorry, I'm a psychologist. But that's going to be the driver. And that sounds fluffy, but it's really truly not, because until we as a community accept that this is a community responsibility, we can't just rely on philanthropy. It's critically important. Philanthropy can come forward with big pots of money to help do innovation and creativity. We can't just rely on government because, oftentimes you get kind of a big swath. It has to be a pairing of the two, but it has to be supported by the public. And when people don't think that pre-K is their responsibility, or early childhood education is something that their tax dollars should pay for, it's never going to get legs. And until we change our mindset about how we support, that we invest in things that we really feel are important, people agree about roads, people agree, for the most part, agree about roads, they agree about other kind of public services. Pre-K needs to be right along with that as a community foundation. And that's where we have to talk about it as the people coming up.
Every one of you belongs to a group that could do something about this. You could bring it up, have a speaker, say you're going to commit to help make sure that we get pre-K for every 4-year-old in Dallas. Way in the back. You're looking back. Yes.
So there's been, I'm sorry, go ahead.
Go ahead.
There's been return on investment work done for a long time, and it's hugely impactful. Even the Bush School has return on investment data about Texas. When we spend on early childhood, we get, I think it's, for every dollar we spend, we get $7 in savings or something like that. It's huge, a huge return on investment. That data's been around for a long time. And we shouldn't stop talking about it. We absolutely should keep doing it. It's critically important. But that's where we're still not seeing that make the impact. So that's where the stories about the impact of a community, talking about the successes in another city, talking about the successes that we hopefully will see in San Antonio with their big push, combining the stories with the data together is going to have a much bigger impact, because we've had the return on investment stuff for a long time, and it's just not having that pow we were hoping that it would have. So I think it's important, but it's got to be combined.
I agree, but I do think what Clay talked about, which is what's happening in Utah. I'm headed to Utah today, this afternoon, and we'll spend the day tomorrow at Granite School District looking at their initiative. Goldman Sachs and the Pritzker Foundation have put up the money for pre-K. It's not the program I want for my kids, because it's part day, which I don't think is good for working families. It's not taught by certified teachers. I really think we need certified teachers. The teachers aren't even getting paid benefits, but it's a good start. And they're looking at it for Chicago, where they have a much higher quality program. But the fact that the business community, the Goldman Sachs, right, is seeing pre-K, and they're seeing also home visiting as a good place to put my money, because I can get my return back, and they're expecting a return of 5%, is pretty incredible. So I think that, really married with what Heckman has done with the data is getting the attention. But Frances is right. It's going to be the stories, and it's going to be you're pushing. You're going in and saying, I'm not here. I have a story from Arkansas. Entergy, which is an energy firm down there, helped on the pre-K in Arkansas, has a good quality program in Arkansas. And when he tells the story, the head of Energy going in and saying, I was there to talk to my representative, and he said, oh, you're not here to talk about energy? You're here to talk about what? Early childhood education. That got his attention. I think Mary's signaling us. Do we have time for one more?
Well, Madeline, you get the last question.
Safety as an issue in regard to
Please do. Absolutely. Yeah.
The other thing, I did academy. I wanted to find out a little more for our purposes. I know you had to blow through that presentation. $1 billion.
Right. we missed the window, and that money is Race to the Top Early Learning Challenge Fund is gone. So the 20 states are there, but it's worth everybody looking at that and watching what's happening, because they are doing amazing things. For example, in Rhode Island, they're taking their health data, Francis, and their education data, and they're putting it together so they're going to really be able to tell, did these kids that got home visiting and got, high quality child care center and got pre-K, do they do better in 3rd grade and 6th grade and high school? So they'll be able to do that. They're working with parents in a number of states. So I hear a story about parents going to the library for a parents, it was a welcome party. And the parents finding out, they didn't know the library was free and that these resources were there for them to use. So there are things like that are happening in every single one of these 20 states that we in Texas can learn from.
Thank you both for being here. I really appreciate it. And gosh, as we're drawing to a close, because I want to be respectful of everybody's time, the Dallas Foundation has been working for the last 10 years on early childhood, and we've worked with Madeline McClure and John Castle to bring the Nurse Family Partnership to Texas, and Reagan Farron and Lisa Bracken, who's here, on the 0 to 5 Funders Collaborative. And so all of these, it just takes time, it takes persistence. And I have just a few facts to leave you with today, just to remember that in 2013, only 49% of Dallas County students entered kindergarten ready to succeed. True. I love it. I probably should stop there, but I have a couple more. Children who enter school behind tend to stay behind, and by the time our Dallas County students reach 3rd grade, only 35% read at grade level. 75% who are struggling readers at 3rd grade remain poor readers in high school, and those struggling readers are 4 times less likely to graduate from high school. It's a continuum, and so we've got to break that pattern. Dallas is well behind other large Texas cities in public pre-K enrollment. There is potentially, this is incredible, $136 million per year in state funding for public pre-K for 3- and 4-year-olds that is not being accessed in Dallas County. We could have that every year. It's not being accessed. That in DISD alone, and Byron knows this, that there are approximately 16,000 eligible students who do not have access to pre-K seats. Alan Cohen is here. He is the new Director of Early Childhood in DISD. That is huge that we now have a Director of Early Childhood in DISD. So we all have to work together. Libby and Francis, thank you so much for being here. We're enthused, and we all know that early childhood matters, but we've got to take action. Thank you all for being here.
Thank you. I'm so sorry.